Okay, so now I'm going to try to break down the three main types of places in terms of the more like emergent, that I guess inpatient services for adults. So the first one would be a mental health hospital. So a mental health hospital, more often than not, you're gonna have to go through the ER. You're gonna have to go through the emergency room to get yourself medically cleared, to be able to make sure that there's, that you're not, in withdrawal, or that you don't have some other medical, neurological, something else that's causing the symptoms that are mental health symptoms. Obviously, a lot of times I think we all tend to just like jump to mental health as soon as there's any signs and symptoms of anxiety and depression and even psychosis. But honestly, there's lots of times where people come in for mental health and it's actually a medical or organic issue with something to do with, an underlying disease or brain issues, neurological stuff that hasn't ever been diagnosed before. Something like an autoimmune disease can even cause mental health issues. So what we do is, if we feel for any reason that, this person doesn't have a history of mental health, for example, if it's like a new onset type of thing where you as the family member definitely, we take what you say to heart, at least I do. We always talk to the family members if we can, if the patient allows us to, because it gives us a little bit of an insight into, are these new symptoms? Do they have any type of history of this in the past? If not, and they're a little bit older, then we kind of do start to tend to look towards whether there was any traumatic or stressful event. And if not, if it just kind of came out of nowhere, then we tend to look for medical reasons. So they would do labs and some other medical testing if needed before we decide whether they need to be admitted or whether they're able to go home and follow up with outpatient, or, do they need medical admission or mental health admission. So the biggest issue with that would be, not the biggest issue, but one of the main issues with that is, the back and forth with the mental health and medical can take a little while to kind of iron out whatever it is that's going on, figure out what's the best care plan. And the mental health hospital, unless you're specifically in a place where they have a longer term stay, a lot of the hospitals that, are just hospitals, they're not maybe like a private mental health place, but like just a plain hospital that you go to, those are not going to be long stays. They try to have a turnover of less than a week if they can. And I would even tell people sometimes, if they were, expecting some like heavy duty, like therapy daily, really, really one-on-one type of services, or even just like some group therapy, that's not honestly always what you're going to get. And I'm going to tell you this straight up. A lot of times people end up getting put on medications. They really don't get that many groups, depending on what hospital, depending on the staff that's there. Meaning if they are short-staffed, they might have less time to do the groups. They may not even be seen every single day by a psychiatrist or therapist. They'll be seen by the nurses every day. And the nurse can obviously express to the psychiatrist or the therapist if there is something that they, feel that needs to be dealt with that day. But there are many, many times where patients don't see the doctor for days. That's just in the couple of hospitals I've worked at. Sometimes the doctor doesn't see all the patients every day because there's usually only one doctor per unit. They see like the new admissions, the people that are leaving, and then, you know, there's a couple people that they may see more than often, just more than usual, just because of maybe medication changes or other things like that. So just know that it's not going to be some intensive everyday therapy for the most part, unless you go to some private place, like there's one up in Saratoga near where we live. I'm not going to use names of hospitals because obviously I'm not like trying to promote or not promote hospitals. I'm just giving information. But I just know that if they're a private hospital, they do, it almost seems more like a retreat type of situation. And you have to be a voluntary participant at those hospitals, whereas like the private hospitals, the public hospitals that are actually I shouldn't even call it a hospital, honestly. The private entities are like their own thing. And then there's the hospitals that have the ER. The private entity, you have to prove that you have no medical, like you cannot have any medical issues, at least the place that's around here. The hospital has the ER with medical floors and mental health floors. That's the one I'm mostly talking about, is when you just go to the ER to get help for mental health. Sorry, I just needed to clarify that. It gets a little bit confusing. So please also, because of the fact that it's confusing, and I'm mostly referencing like my area because I've worked at the hospitals around here. If you have any questions or you don't understand what I'm saying or the terminology or whatever, please just ask questions, message me, comment below. I will answer the questions. I can also help you, kind of guide you in your individual issue as well if you have a specific question. So that's the first type is mental health hospitals. Okay, this is for people who really don't have a substance use issue. I mean, there may still be some substance involved, but for people who are heavily using or drinking, oftentimes they will end up getting referred to another place first. So this is kind of going to go back and forth a little bit. This is how there can be that ping pong effect with different places. So I can give some scenarios, but first I'll just say that most likely if you have a serious substance abuse problem, you can't be admitted to a mental health unit if you are highly intoxicated with alcohol or another drug. Sometimes if you're detoxed in the ER, or they can see that you're detoxed ahead of time, then they'll just put you on like a withdrawal protocol. So they'll monitor you on the mental health unit to make sure that you aren't going into really bad withdrawal. But that varies by hospital. So again, if it's a private entity, they're not going to take someone who is possibly going to be withdrawing because they don't have medical services on that site. If it's a regular hospital, they're going to be more likely to take people withdrawing.